Hello, everyone. Let's start with an important reminder. Vaginas are not machines. They are living, changing organs. They respond to hormones, age, stress, sex, pregnancy, and even life just happening. So if you've ever thought, wait, is this normal? Congratulations, you're human. Today, we're talking about 5 vaginal changes that often cause panic, but are actually completely normal. And yes, we're normalizing all of it. Discharge is one of the most misunderstood parts of vaginal health, and honestly, it causes a lot of unnecessary fear. Many people grow up thinking that if they notice discharge in their underwear, something must be wrong. But here's the truth. Vaginal discharge is not a sign of illness by default. It's a sign that your vagina is alive, functioning, and protecting itself exactly the way it's designed to. The vagina is a self-cleaning organ, and discharge is part of that cleaning system. Its job is to carry away old cells, bacteria, and fluids to keep the vaginal environment healthy and balanced. What often surprises people is how much discharge can change. It's not supposed to look the same every single day. Hormones play a huge role here, especially estrogen. During different phases of the menstrual cycle, discharge can look and feel very different. After your period, it may be light or barely noticeable. As you approach ovulation, it often becomes clearer, wetter, and stretchy, sometimes compared to raw egg whites. This isn't gross or alarming. It's actually a sign of fertility and normal hormonal shifts. After ovulation, discharge may become thicker, creamier, or more white in color. All of this falls within the range of normal. Discharge can also change during pregnancy, while using birth control, or during times of stress or illness. Pregnancy often increases discharge because of hormonal changes and increased blood flow to the pelvic area. Birth control can make discharge lighter or heavier depending on the type. Stress can even affect it because stress affects hormones and hormones affect the vagina. None of this means something is wrong. It means your body is responding to internal changes. Color and texture matter more than quantity. Normal discharge can be clear, white, milky, or slightly yellow when dry. It can be slippery, sticky, or thick. What usually signals a problem is not more discharge, but discharge that comes with other symptoms. Strong or unpleasant odors, especially a fishy smell, green or gray coloring, cottage cheese-like clumps with itching, or burning and pain are reasons to check in with a healthcare provider. Discharge by itself without discomfort or odor is usually just your vagina doing its job. And let's talk about the shame around it. Many people feel embarrassed buying panty liners, checking their underwear, or even talking about discharge at all. But discharge is not dirty. It's not a failure of hygiene. In fact, trying to fix discharge with douching, scented washes, or internal cleansers often makes things worse by disrupting the natural balance of bacteria in the vagina. A healthy vagina doesn't need help cleaning itself. It needs to be left alone. So if you notice discharge and your first thought is panic, take a breath. Ask whether there's pain, itching, or a strong smell. If not, chances are very good that this is completely normal. Your vagina isn't betraying you. It's communicating, maintaining balance, and protecting you every single day, even when no one taught you that this is exactly how it's supposed to work. Vaginal odor is one of the most common reasons people worry that something is wrong, and it's also one of the topics surrounded by the most misinformation. Society has pushed the idea that a vagina should smell like nothing at all, or worse, like artificial flowers or soap. That expectation is unrealistic and not based in biology. A vagina is part of a living body, not a scented product. Having a natural smell is normal, healthy, and expected. Every vagina has its own baseline scent, and that scent can be slightly musky, earthy, or tangy. This comes from the natural balance of bacteria that live in the vagina, especially lactobacilli, which help keep the environment slightly acidic. That acidity is actually protective. It prevents harmful bacteria from growing too easily. So when a vagina smells like a vagina, that's usually a sign that things are working exactly as they should. It's also normal for vaginal odor to change at different times. During your menstrual cycle, the presence of blood can alter the smell because blood has a different pH. After exercise, sweating in the groin area can mix with vaginal secretions and create a stronger scent. After sex, semen, which is alkaline, can temporarily change vaginal pH and odor. None of these situations automatically mean infection. They're normal responses to normal life events. What matters most is not whether there's any smell, but whether the smell is strong, unpleasant, or new for you. A fishy odor, especially if it's noticeable after sex, may be associated with bacterial vaginosis. A rotten or foul smell, particularly with pain or discharge, could signal an infection or a retained object like a forgotten tampon. These are reasons to seek medical care, not because odor itself is bad, but because sudden or extreme changes can be a sign that something needs attention. One of the biggest mistakes people make when they're worried about odor is trying to eliminate it with internal cleansing. Douching, scented washes, deodorant sprays, and perfumed wipes can disrupt the natural vaginal environment. When you wash away healthy bacteria, you actually increase the risk of infections that cause strong odors. In other words, trying to make a vagina smell like nothing often creates the exact problem people are trying to avoid. External hygiene is usually all that's needed. Washing the vulva with plain water or a gentle, unscented cleanser is enough. The vagina itself does not need to be cleaned. It is self-regulating and self-cleaning, and interfering with that process can cause more harm than good. There's also a huge emotional component to vaginal odor. Many people feel embarrassed, ashamed, or anxious about being found out, especially in intimate situations. But having a natural scent does not make someone unclean, undesirable, or unhealthy. Bodies have smells. That's normal biology, not a personal failure. If you ever notice a smell that is new, strong, or associated with symptoms like itching, burning, pain, or unusual discharge, that's a good reason to talk to a healthcare professional. But if the smell is mild, familiar, and changes slightly with your cycle or daily activities, that's usually just your body being a body. Your vagina is not supposed to smell like roses, it's supposed to smell like itself, and that is completely normal. Changes in the color of the vulva and vaginal area are incredibly common, yet they're rarely talked about honestly. Many people expect the skin in this area to look the same throughout their lives, or to match the tone of their face or the rest of their body. That expectation usually comes from edited images, unrealistic beauty standards, and a serious lack of education, not from biology. In real life, vulvar skin naturally varies in color, and it often becomes darker over time. The vulva includes the labia majora, labia minora, clitoris, and surrounding skin, and all of these areas can have different shades. It's completely normal for the labia, especially the inner labia, to be darker than the outer skin. This happens because the vulva is rich in blood vessels and sensitive tissue. Increased blood flow and pigmentation in this area are part of normal anatomy, not a sign of disease or poor hygiene. Hormones play a major role in these color changes. During puberty, rising estrogen levels can cause the vulva to darken. Pregnancy often leads to further darkening due to hormonal shifts and increased blood flow, sometimes referred to as hyperpigmentation. After childbirth, the color may lighten again, or it may not. Both outcomes are normal. Aging also affects pigmentation, just like it does on the face or hands. None of these changes mean something is wrong. They mean your body is responding to hormonal and physiological changes. Genetics matter too. Some people naturally have darker vulvar skin from the start, just as people have different skin tones on their arms, legs, or lips. There is no standard or correct vulvar color. Healthy vulvas exist in a wide range of shades, from light pink to deep brown and everything in between. Diversity is the norm, not the exception. Another factor that can contribute to darker skin in the vulvar area is friction. Tight clothing, frequent shaving, waxing, or regular skin-to-skin contact can all lead to mild darkening over time. This is the skin's normal response to repeated irritation. It doesn't mean you've done something wrong, and it doesn't mean you need to fix it. What's important is knowing when color changes might need medical attention. Sudden changes accompanied by pain, itching, sores, thickened skin, or unusual textures should be evaluated by a healthcare provider. But gradual darkening over months or years without discomfort is almost always normal. The pressure to lighten or correct vulvar color has led to harmful trends, including bleaching creams and harsh treatments. These products can damage sensitive skin, cause burns, scarring, and long-term irritation. There is no medical reason to lighten the vulva, and no reputable healthcare provider recommends it. Feeling self-conscious about vulvar appearance is common, but it's rooted in unrealistic standards, not reality. Vulvas are not meant to look uniform, symmetrical, or unchanged over time. They are living parts of the body that grow, adapt, and age. If your vulva looks different than it did years ago, that doesn't mean it's unhealthy. It means you're human. Color changes are a normal part of life, and your body does not need to meet anyone else's expectations to be normal or worthy of care. Vaginal wetness and dryness are often misunderstood, and many people quietly worry that either one means something is wrong with their body. In reality, both are normal experiences that can change from day to day, sometimes even hour to hour. The vagina responds to hormones, blood flow, emotional state, medications, and overall health, so it's expected that moisture levels won't stay exactly the same all the time. Vaginal wetness is commonly associated with sexual arousal, but it's important to understand that lubrication and desire are not the same thing. A person can feel mentally aroused without much physical lubrication, and someone can be wet without feeling sexually aroused at all. Natural moisture is influenced by estrogen, which increases blood flow and fluid production in the vaginal tissues. During certain points in the menstrual cycle, especially around ovulation, wetness can increase. This isn't a signal you're too sexual. It's a sign your hormones are doing what hormones do. On the other side, vaginal dryness is also very common. Many people experience dryness while breastfeeding, during menopause, while using certain hormonal birth control methods, or when taking medications like antidepressants or antihistamines. Stress and dehydration can contribute as well. Dryness doesn't mean your body is failing or that you're doing something wrong. It means the vaginal tissues are producing less moisture at that time, often due to lower estrogen levels. Dryness can feel uncomfortable, especially during sex, and it's okay to address it. Using a lubricant during sexual activity is not a sign of inadequacy or dysfunction. Lubricants are tools, not evidence that something is broken. For ongoing dryness, vaginal moisturizers or medical treatments recommended by a healthcare provider can be helpful. Suffering in silence is not required, and comfort matters. Cultural messaging often turns vaginal wetness into something shameful or embarrassing, especially when it's visible through clothing or underwear. This can lead to unnecessary anxiety and overcleaning. At the same time, dryness is sometimes framed as something to fix or hide rather than a normal variation of the body. Both perspectives miss the point. Vaginas change in response to life stages, hormones, and circumstances, and those changes are normal. It's also important to note that arousal-related wetness can be affected by factors unrelated to attraction, such as anxiety, fatigue, trauma history, or physical health. A lack of lubrication does not mean a lack of interest or desire. Bodies don't always cooperate on command, and that's okay. What matters most is how you feel. If dryness is causing pain, tearing, burning, or recurrent infections, that's a good reason to talk to a healthcare professional. If wetness comes with itching, strong odor, or unusual discharge, that should be evaluated as well. But in the absence of these symptoms, variation in moisture is typically just your body adjusting to internal changes. The idea that a vagina should always be perfectly lubricated or never moist is a myth. There is no ideal level of wetness. There is only what's normal for you at that moment in time. Your body is allowed to change, and you are allowed to use support, like lubrication or medical care, when you need it. Vaginal wetness and dryness are not moral judgments or medical failures. They are simply part of being human, and they deserve understanding, not shame. Changes in how the vagina feels after sex, childbirth, or simply with age are one of the biggest sources of anxiety, largely because of myths that refuse to die. Many people are taught, directly or indirectly, that the vagina should stay exactly the same forever. And if it doesn't, something has gone wrong. That idea is not rooted in anatomy or medicine. It's rooted in unrealistic expectations. The vagina is made of muscle and elastic tissue, and like every other part of the body, it adapts to use, hormones, and time. After sex, it's normal for the vagina to feel temporarily different. Increased blood flow, muscle relaxation, and natural lubrication can make sensations feel fuller, softer, or more open for a short period of time. This is not damage. It's a normal physiological response that usually resolves on its own. Sex does not permanently stretch out or ruin the vagina. Vaginal tissue is designed to expand and then return to its resting state. Childbirth is another major event that can change how the vagina feels, and it's important to talk about this honestly and without shame. During a vaginal birth, the muscles and tissues stretch significantly to allow a baby to pass through. After delivery, it can take weeks to months for the pelvic floor muscles to regain strength and coordination. Some people notice differences in sensation, pressure, or muscle control during this time. That doesn't mean the vagina is permanently damaged. It means the body has done something extraordinary and is recovering. Pelvic floor muscles, like any muscles, can be strengthened. Pelvic floor physical therapy can be incredibly helpful for issues like discomfort, leaking urine, or changes in sensation after childbirth. These changes are common, treatable, and not something anyone has to just live with. Seeking help is not a sign of failure, it's a sign of caring for your health. Aging and hormonal changes, especially around menopause, also affect vaginal tissue. Lower estrogen levels can lead to thinner, less elastic tissue and changes in sensation or lubrication. These shifts are normal and happen gradually. They don't mean your body is broken or that intimacy has to end. There are safe, effective treatments available, including vaginal estrogen and moisturizers, that can greatly improve comfort and quality of life. One of the most harmful myths is the idea that the vagina becomes loose from sex or childbirth. This concept has no scientific basis. Vaginal tone is influenced by muscle strength, hormones, and overall pelvic health, not by how many times someone has sex or whether they've given birth. Vaginas are resilient. They are designed to stretch and recover. Emotionally, these changes can bring up feelings of insecurity or grief, especially when no one prepared you for them. That reaction makes sense. Bodies change, and change can feel uncomfortable, but change does not equal loss of value or function. It means your body has lived, adapted, and carried you through different stages of life. If changes come with pain, bleeding, pressure, or problems with bladder or bowel control, those are reasons to seek medical care. But experiencing differences in sensation or strength over time is a normal part of having a body. The vagina is not meant to stay frozen in one state forever. It evolves with you, and that adaptability is not a flaw. It's one of its greatest strengths. Many people are taught to view any change in their vaginal health as a warning sign, which creates a constant sense of vigilance and fear around their own bodies. This leads to overanalyzing every sensation, every spot on underwear, every feeling that's slightly different from yesterday. But bodies are not static, and expecting them to behave the same way forever sets people up for unnecessary anxiety. One of the most normal yet rarely discussed changes is simply variation over time, how the vagina responds differently depending on life stage, health, and circumstances, even when nothing is medically wrong. Stress alone can change how the vagina feels. When the body is under stress, muscle tension increases, blood flow patterns shift, and hormone levels can fluctuate. This can lead to sensations like tightness, discomfort, or reduced lubrication. None of this means there's a disease process happening. It means the nervous system is involved, and the vagina, like the gut or the jaw, responds to stress because it's connected to the rest of the body. This is normal physiology, not a personal failure. Emotional experiences also play a role. Anxiety, past trauma, or even fear about vaginal health itself can influence sensation and comfort. The pelvic floor muscles can tighten unconsciously, leading to discomfort during penetration or exams. This doesn't mean the vagina is malfunctioning. It means the body is protecting itself. With education, reassurance, and sometimes professional support, these patterns can change. Another normal change that worries people is becoming more aware of their vagina over time. As education improves or as someone becomes more attentive to their body, they may notice sensations they didn't pay attention to before. Awareness doesn't mean something new is wrong. It often just means you're listening more closely. Increased awareness can feel alarming if no one has explained what's normal. There's also a common fear that if something isn't talked about openly, it must be abnormal. In reality, many normal vaginal experiences aren't discussed simply because of stigma. That silence creates the illusion that everyone else's body is stable and predictable, when in fact, most people are experiencing the same changes quietly. Normal does not mean rarely changing. Normal means adaptable. Knowing when to seek care is important, but so is knowing when reassurance is enough. Persistent pain, unexplained bleeding, strong or unusual odors, itching, burning, or sudden dramatic changes deserve medical evaluation. But subtle shifts in sensation, appearance, or comfort, especially when they happen gradually, are often part of normal body variation. The vagina is not a problem to be solved. It is a responsive, sensitive organ that reflects hormonal health, emotional state, and overall well-being. Expecting it to behave the same way every day ignores how dynamic the human body really is. Variation is not failure. Change is not damage. Understanding this can be incredibly freeing. Instead of constantly asking, "What's wrong with me?" the question becomes, "What is my body responding to right now?" That shift from fear to curiosity can transform how people experience their vaginal health. Your body is not broken because it changes. It is functional, resilient, and doing what bodies are meant to do, adapt, and that too is completely normal. If there's pain, strong odor, itching, burning, or sudden changes that worry you, see a healthcare professional. But if your concern is, "This feels different than before," that doesn't automatically mean something is wrong. Normal doesn't mean talked about, and common doesn't mean taught. Your body is not failing you, it's communicating with you, and that's normal. And